Hello, how are you doing? The content of this video is to provide information on fasting. For medical advice or diagnosis, consult a professional. Clinical trials are exploring the potential benefits of combining fasting or fasting mimicking diets with chemotherapy. Some studies show that fasting may reduce side effects, improve treatment effectiveness, and even boost immunity. Therapeutic fasting in the form of intermittent fasting, short-term fasting, and fast-mimicking diet for a period of 24 to 72 hours before chemotherapy and/or 24 hours following chemotherapy in patients with cancer was well tolerated without any serious side effects. No patients experienced significant weight loss at the end of the studies. However, this is not generalizable as most studies have had small sample size. You always need to seek advice from your health provider. There are suggestions that the potential benefits of fasting with chemotherapy include reduced chemotherapy side effects. Some studies suggest that fasting may protect normal cells from the toxic effects of chemotherapy, leading to fewer or less severe side effects. Improved treatment. Effectiveness. Research indicates that fasting might enhance the effectiveness of chemotherapy by making cancer cells more vulnerable to treatment. Fasting might boost immunity. Fasting has been shown to reprogram the immune system, potentially enhancing its ability to fight cancer and potentially improve the effectiveness of immunotherapy. Whether fasting is useful for you, it is advised to discuss with your health provider to avoid malnutrition or other possible problems. There are different types of fasting. Short-term fasting. This involves restricting food intake for a period of time, typically 72 hours. Intermittent fasting. This involves alternating between periods of eating and fasting, with a focus on restricting food intake during specific hours of the day. Intermittent fasting. This involves alternating between periods of eating and fasting, with a focus on restricting food intake during specific hours of the day. Fasting mimicking diets. These are diets that mimic the effects of fasting by significantly reducing calorie intake while still allowing some food consumption. Seek advice from your health provider about what types of fasting might suit you. More large-scale, well-controlled trials are needed to confirm the effectiveness of fasting and fasting-mimicking diet in combination with chemotherapy and to identify the best approaches for different cancer types and patient populations. Most clinical trials have shown that short-term fasting is generally safe and well-tolerated in patients undergoing chemotherapy, but more research is needed to fully assess the long-term effects. The ideal fasting or fasting-mimicking diet regimen may vary depending on the individual's cancer type, overall health, and response to chemotherapy. For medical advice or diagnosis, consult a professional. Till the next video, stay sound and healthy.